My first dedicated paper in MDS more than 10 years ago was in the cause of death in patients with low-risk MDS. So when we tracked that, the number one cause of death was infection. The second was bleed. The third actually was progression to AML. Traditionally, people thought that these patients transform, and that's like the major cause of death. No, it turns out that infection is the number one cause of death. So understanding this process is very important. Now, I think what is emerging that is really interesting is that there is a strong correlation between comorbidities and mutations in patients with myelodysplastic syndrome. So let's see if I can explain that. So we know that these mutations that we call chronal hematopoiesis that are common in this subset of patients with this kind of pre-MDS syndrome. So with Dr. Naqvi, a couple of years at MD Anderson, we did an analysis linking mutations with comorbidities with a specific subset of patients with MDS. And we found that there's actually kind of a strong correlation between particular mutations and particular comorbidities in patients with MDS. So this process is not stochastic. And this probably could explain this correlation between comorbidities and the disease. And what this means actually is that these comorbidities do not exist only because these patients are older, but maybe also because they have these particular mutations. So this is really interesting because you could maybe then understand what the natural history is going to be for particular patients with particular mutations. So for instance, in our data set, patients with DNMT3A mutations had increased risk of cardiovascular disease. Patients with JAK2 mutations had more veno-occlusive type of events. So all this put together is going to help us understand basically what really happens with these patients. And I think it's all actually at the molecular level.